Good morning, Ms. Williams. My name is Megan. I'll be your nurse for today. I'd like to perform an abdominal assessment. I'd like to perform this assessment on bare skin, so I'd like to raise your shirt, keeping the breast covered. I'd like to note that the contour of the abdomen appears to be flat. I'd like to note that there is no distension. From a second angle, the abdomen continues to appear flat without any distension. Also noting the umbilicus, which appears to be centrally located. The umbilicus appears to be completely intact. There are no unusual scars, there are no lesions. I'm noting that there are no unusual venous patterns or dilated vessels, and I'm noting that there are no unusual pulsations across the abdomen. Now I'd like to assess for a hernia. So I'll have you raise your head as if to look at your feet, and I'll gently palpate just above the umbilicus, and I'll gently palpate in the lower abdominal region. If you'll raise your head for me as if to look at your toes, just gently palpating above the umbilicus and just gently palpating and observing the lower abdominal region. Now I'd like to auscultate the abdomen. Starting in the right lower quadrant, I'll use the diaphragm of my stethoscope. I expect to hear positive vowel sounds in this region. Positive vowel sounds in the right lower quadrant. Positive vowel sounds in the right upper quadrant. Moving clockwise to the left upper quadrant. Positive vowel sounds, and in the left lower quadrant we have positive vowel sounds. I'd now like to use the bell of my stethoscope over the abdominal aorta, just above the umbilicus and to the left of the umbilicus. Okay. I'd now like to percuss across the abdomen, starting in the right lower quadrant. Just moving clockwise over to the left upper quadrant, down to the left lower quadrant. I'd now like to palpate, starting again in the right lower quadrant. I'll have you raise your knees. Thank you. Keep your feet flat on the bed, and I'll just gently palpate. I'll notice for any unusual facial expressions that indicate pain. I'll also look for any rebound tenderness. Starting in the right lower quadrant, moving up to the right upper quadrant, over to the left upper quadrant, and down to the left lower quadrant. I'm noting that there are no signs of rebound tenderness, and there are no signs of facial distress, which could indicate pain as I palpate. There are none of those signs present. Now I'd like to assess the kidney region. If you could just sit up straight in this bed for me, and I'm just going to palpate over the kidney region. I'll just gently strike just the kidney region, starting on the right lower side here, moving over to the left side. And that concludes the assessment for today. Thank you for your time.